Helping you to understand the mechanism of normal labour. We've got the mum represented by the pelvis, so the mum is supine, and we've got the fetus entering the pelvis in the right occipito-anterior ROA position. At some point towards the end of pregnancy, or sometimes in early labour, the fetal head will enter the inlet of the maternal pelvis, and it does so with sagittal suture of the fetal head in the transverse diameter of the maternal pelvis. As labour progresses and contractions get stronger, we have something called fetal axis pressure, which is where the pressure of the uterine contractions pushes down on the fetal sacrum and it makes the baby's head flex, which results in the smallest diameter of the fetal head presenting, and that's the suboccipito-brachmatic diameter. As labour progresses, we get increased pressure down the fetal axis caused by increasing strength of uterine contractions. This causes descent of the fetus through the maternal pelvis. As the occiput meets the resistance of the maternal pelvic floor, we get a rotation causing due to the shape of the maternal floor, and it causes the fetal occiput to rotate anteriorly by 1/8. However, it's very important to note that the shoulders do not rotate through this same 1/8, and this results in a misalignment between the fetal shoulders and the fetal head. As labour progresses and we get increasing fetal descent, the occiput will slip beneath the suprapubic arch, and this is when crowning can occur. The fetal head pivots on the suboccipital region and extends, and this releases the syncciput, the face and the chin, which sweep the perineum. The fetal head is now free to do something called restitution. Restitution is where the fetal head and the fetal shoulders realign. There is the untwisting of that 1/8 rotation. At the same time, we get increasing descent of the fetus, and now the anterior shoulder meets the resistance of the pelvic floor, and that too rotates anteriorly 1/8. We get increasing descent, and the anterior shoulder sweeps underneath the pubic arch, and the posterior shoulder slips into the curve of Caris, or the hollow of the sacrum. As it does so, we get lateral flexion of the fetus, and the baby is born by lateral flexion. And this is known as the mechanism of normal labour. This video has demonstrated